Multnomah County, we would always be analyzing the geographic areas that had the highest density of need. And at that time, both the area in North Portland around Roosevelt High School and the area in Northeast Portland around Jefferson High School had some of the highest uninsured rates, health problems, and teen pregnancy happening. Back in 1985, there were a lot more uninsured teens and everybody than there is now. And so it was a real barrier for students to go in for health services.
The setup in Roosevelt High School was in a place that had been book storage, and kind of at the back of the lower level, kind of subterranean actually, that part of it was below the soil level outside. So we were definitely low, and it was dark. And they took out the bookshelves, which had a concrete floor. They put up partitions probably 6 feet high, which didn't give you good privacy. But the students came anyway. There was so much need there, I think they came on their own. We didn't really even need to do marketing of any kind. There was some organized resistance to the idea of having a school-based clinic, primarily because of the reproductive services we offered, even though we made it clear we were not dispensing birth control on-site. So students still had one barrier to jump to get their birth control pills or whatever they might choose. But as far as examining and counseling and diagnosis, that could be all done on site, and that was objectionable to certain, in some cases, religious groups, some other, ethical objections, primarily not from the people in the Roosevelt community. They came from other parts of the county and even from out of state. And we had one afternoon of pickets outside the building by the door that went down the steps to the steps into the clinic. The next day it rained and they disappeared like that.
Became a real integral part of the school and did more than just our usual primary care services. Did a lot of education, a lot of outreach, a lot of support, and I just want to say that the staff really made that clinic. It wasn't too long, and the Portland Public Schools and kind of community and us believed we needed another one. So we held more public meetings and ended up then starting one at Jefferson High School. And it, kind of grew from there.
I've been coming to the health center for a year, my whole 9th grade. Yeah. Well, I do think it's convenient because people, like kids or students, can come to the clinic whenever they want, and they don't need their parents to come with them. And it's not far away from where we live, and it's in the neighborhood.
Well, I like that we have a health center here at the school, a safe place for the kids to come in and to talk about their concerns. And I also like it because the access to them, that they don't have to go, to the regular doctor. We are a regular doctor's office, and most of the times the teenagers don't know their students. But we are a regular doctor's office, and they can just come in, and instead of calling their parents, it's very easy. Just come in and be seen and go back to class.
I love being a part of teenagers' lives, their concerns, their joys, their frustrations, their challenges. It's important to have it here so that it reduces any barriers and obstacles for students to seek confidential care. I think probably what's most important, and that I would be the first to say, is the fact that we have had a school-based health center for 30 years. That this is something that taxpayers, administrators, the health department has found to be valuable, and that it continues to remain relevant and present. I think that's the most impressive detail to me.